Can H. pylori ulcer treatment really cure it? Let's dive into a common question. Can treatment for Helicobacter pylori infection really cure ulcers? The answer is yes. Treatment aimed at eradicating H. pylori can effectively cure ulcers caused by this bacterium, especially peptic ulcers. By eliminating the underlying infection, healing of the ulcerated tissue can occur, and the chances of recurrence drop significantly. H. pylori infection is a leading cause of peptic ulcers, which include both duodenal and gastric ulcers. In fact, most people with duodenal ulcers are infected with H. pylori. Therefore, curing this infection is crucial for resolving ulcer disease and preventing it from coming back. Standard treatment usually involves a combination of antibiotics and acid-suppressing medications known as proton pump inhibitors. A common regimen might include a proton pump inhibitor along with 2 antibiotics, such as clarithromycin and amoxicillin or metronidazole. This treatment typically lasts between 7 to 14 days. The success rate of these treatments can vary, but it generally falls between 70 to over 90%. Factors influencing this success include the specific treatment regimen, how well the patient follows the instructions, and local patterns of antibiotic resistance. For instance, triple therapy using clarithromycin and a proton pump inhibitor often achieves eradication rates around 70 to 85%. In contrast, newer or quadruple therapies that include bismuth compounds can reach eradication rates of 90% or higher. Another approach, known as sequential therapy, involves a 2-step antibiotic regimen over 10 days and has shown eradication rates exceeding 90% in some studies. However, challenges can arise, particularly with antibiotic resistance, which is becoming more common worldwide and can reduce the effectiveness of treatment. If the initial therapy does not work, alternative regimens with different antibiotics or longer treatment durations may be necessary. Testing the bacteria for antibiotic sensitivities can also help in choosing the right treatment. Successfully eradicating H. pylori not only heals the ulcer but also significantly lowers the risk of recurrence and complications, such as bleeding. This treatment approach is supported by major health authorities and is widely accepted as the standard care for H. pylori-associated peptic ulcer disease. In summary, treatment for H. pylori can indeed cure the infection and the associated ulcer in most cases when appropriate antibiotic regimens are used and followed correctly. However, treatment success can depend on factors like antibiotic resistance and adherence to therapy. It is crucial to have medical supervision to ensure effective treatment and follow-up. Always consult your healthcare provider for personalized advice and treatment options.